What is IgG in foals, and what is passive transfer? If you've recently welcomed a foal or are researching newborn foal health, these are two of the most important terms you'll encounter. IgG, or immunoglobulin G, is the primary antibody that helps protect a foal from disease. Passive transfer is the process by which a foal absorbs IgG antibodies from its mother's first milk, known as colostrum. Without successful passive transfer, a foal has a much higher risk of developing serious infections during the first days and weeks of life. So why is passive transfer so important? Unlike human babies, foals receive little to no meaningful antibody protection before birth. The equine placenta prevents most maternal antibodies from reaching the developing foal during pregnancy. While scientists have identified trace amounts of immune factors that may cross the placenta, these amounts are not enough to provide significant protection against disease. As a result, newborn foals enter the world with very limited immunity and depend heavily on colostrum to survive and thrive. When a foal is born, it may look strong, healthy, and ready to explore the world. Within minutes, many foals are attempting to stand, and within a few hours, they're searching for the mare's udder. What many horse owners don't realize is that this first nursing session is one of the most important moments in the foal's entire life. That's because colostrum contains extremely high concentrations of IgG antibodies. These antibodies are specialized proteins produced by the immune system to recognize and fight bacteria, viruses, and other disease-causing organisms. In adult horses, IgG antibodies circulate continuously throughout the bloodstream, providing protection against many infectious diseases. However, newborn foals don't yet have enough antibodies of their own. Fortunately, nature has a solution. During the first few hours after birth, a foal's intestinal tract is uniquely designed to absorb these large antibody molecules directly from the colostrum into the bloodstream. When the foal drinks high-quality colostrum, those IgG antibodies enter circulation and begin protecting the foal from disease. This transfer of antibodies from mare to foal is called passive transfer. In many ways, passive transfer is the mare's way of lending her immune system to her newborn foal until the foal's own immune system defenses mature. The timing is critical. The highest absorption of IgG occurs during the first 6 hours after birth. After that, the foal's ability to absorb antibodies steadily decreases. By about 24 hours of age, the intestinal wall has essentially closed to antibody absorption. This means that every hour counts. If a foal does not consume enough colostrum, or if the colostrum contains insufficient antibodies, the foal may develop a condition called failure of passive transfer, often abbreviated as FPT. Failure of passive transfer is one of the most common health concerns in newborn foals and can significantly increase the risks of septicemia, pneumonia, diarrhea, joint infections, and other serious illnesses. Because of these risks, veterinarians often perform an IgG test in foals between 12 and 24 hours after birth. This simple blood test helps determine whether passive transfer occurs successfully and whether the foal received adequate antibody protection. So if you're wondering, what is IgG in foals? The answer is simple. IgG is the antibody that protects the foal from disease. And if you're wondering, what is passive transfer? It's the process by which a foal absorbs those protective IgG antibodies from colostrum during the first hours of life. Together, IgG and passive transfer provide the foundation of a newborn foal's immune protection and are among the most important factors influencing early foal health and survival. Thank you so much for joining us, and remember, I am not AI. If you listen closely, you can hear me breathing.